Some of the UK's biggest nightclubs have joined the effort to encourage young people to get a coronavirus jab. More than two-thirds of young adults aged 18 to 29 have had their first dose, but there's concern the industry's future could be in jeopardy if they decide against getting the second one. Among those pushing the drive is Dr. and DJ Badalia. Hello to you. It's nice to see you. Thanks for joining us on the programme this morning. Why do you think young people are reluctant to come forward for either their first and or second jabs?
I think there's definitely a few reasons of this. I think there's a perceived lack of convenience. Now, in terms of sort of combating that answer, basically, people can get the jab quite conveniently. All they've got to do is call 119, visit nhs.uk, or visit one of their walk-in centres, or pop-ups, for example, Heaven nightclub on the 8th of August. It's very, very convenient. There's also this perceived lack of safety. Now, all the vaccines, all the COVID-19 vaccines, like other medications, have gone through rigorous clinical trials to prove that they're safe, they're effective, and they're of good quality. So I think these are two of the main reasons, but there's also the side effects. Now, in terms of side effects, most people don't experience any at all. And if you do, they tend to be very mild. You might get a headache, feel a bit sick, might feel a bit achy. Normally, simple painkillers like paracetamol can help, but there's always a doctor on hand or a healthcare professional if you have any concerns whatsoever.
OK, so what do you think, Doc, about the suggestions that if people are not double vaccinated, they shouldn't be allowed access to nightclubs?
Well, actually, there is good evidence to suggest from around the world that by being in these enclosed indoor spaces, there is a greater association with social contact. People are much closer together. They might be under the influence of alcohol. And this association is tied to an increased risk of spread of coronavirus, which means that you're more likely to catch coronavirus and you're also more likely to pass it on to others. So really having both jabs, being double jabbed, is the best way to protect yourself and others. It's the way for us to get back to our normal lives and to enjoy the good times again.
The new incentives that we've been talking about, do you think those might make the difference? And in particular, if so, which ones?
I think, there's this thing about the COVID-19 passports. I think it's very important that we get these jabs, because by being double jabbed means we can go to clubs and enjoy ourselves. So I suppose that's a good incentive to get those jabs, because then we can go out, have a good time. People over the age of 18 like to go out and socialise. But this is important because it'll protect yourself.
Yeah, indeed. So if you don't have the jab, young people can still get COVID and can still be very ill, but they would say, I suppose, very rarely die.
We're seeing increasing numbers of unvaccinated young people coming into hospital, more than we saw a few weeks ago. My colleagues who are working in the intensive care units are saying beds are filling up. I was working in A&E yesterday, and we have more cases of young patients with coronavirus coming in. So if you are unvaccinated, it is very important to give yourself that level of protection. Now, being vaccinated means that you're less likely to catch it. You're less likely to develop severe infection and severe symptoms, less likely to be admitted to hospital, less likely to die, and less likely to spread it to other people as well. So you should get vaccinated. And I'd like to encourage particularly 18 to 24-year-olds, because they're a group of people who aren't actually taking up the vaccine as much as they should be.
So there's an awful lot of myths, I suppose, people in your position would say, online, talking about fertility, talking about changing people's genome sequence, etc., etc. Where do young people who do want to consider having a vaccination but need the facts, where do they go?
Best place to look is on the NHS website. Credible source information on the NHS website. A key, that's number one. Second thing to do is to speak to your doctor.
OK, it's great to see you. Thanks for bringing the decks out, especially for us this morning. Much appreciated.
Thank you.
It's great. Thanks a lot.
Well, unvaccinated young people are being warned today that they will miss out on access to nightclubs as part of a new advertising campaign that's being launched by the government to boost the take-up of the vaccine. The campaign on billboards and on social media will focus on the freedoms that vaccinations will allow, from nightclubbing to foreign travel, with London venues, including Ministry of Sound, urging people to get jabbed so they can all keep dancing together safely. Let's have a quick look at this new campaign. Well, let's talk about this new campaign with a doctor and a DJ, Bodalia, who is also founder of NHS Sessions. And you're in a pretty unique place, perhaps, to talk about this, really. As a doctor, first of all, with your medical hat on, tell us what is your experience, because I know you work in A&E, and in terms of young people contracting COVID because they haven't had the vaccine, what's your experience on that?
That's right. I've been working across a variety of different wards over the last year and a half, A&E, the intensive care unit, even in a GP setting in the community. And young people are catching coronavirus and they're falling seriously unwell from it. Just a few days ago, I had a 22-year-old boy who was struggling to speak on the phone and has to be admitted to hospital with a pneumonia. So that shows that this virus has the potential to be incredibly serious. And that's why with this campaign, we would love to encourage 18 to 24-year-olds to get both jabs as soon as possible.
Quite a lot of that age group, though, they're a bit reluctant to have the jab, either because they don't think they need it, or actually, you know, they think they're pretty healthy, and even if they get COVID, it won't be a big deal for them.
That's correct. And actually, there's a few reasons why they've not been having it. It's the perceived lack of convenience. Now, that's not true, because call 119, you can book in very easily. Visit nhs.uk, you can book in, or visit a walk-in centre or one of the pop-ups like Ministry of Sound or Heaven Nightclub. There's been some questions regarding safety, but the vaccines have undergone the same rigorous clinical trials as other medications that are available. And this means they've been tested for safety, quality, and effectiveness. So that should reassure them on that front. And in terms of side effects, most people are absolutely fine. Some people develop very mild side effects, for example, an achy arm, a headache, body aches, might feel generally unwell for a few days, but simple painkillers and rest, paracetamol will help you feel better. But obviously, if anyone had any concerns before getting the vaccine or after it, any side effects, there's always a healthcare professional or a doctor on hand.
So you're also a DJ as well as a doctor, and the message really to young people is don't miss out on the fun. And you know, the best way not to miss out is to get double jabbed, because there might be this new rule which means you have to be double vaccinated to get into nightclubs. It's a bit of a carrot and stick approach, isn't it? It's kind of trying to encourage young people, but also warning them that if they don't get the vaccine, they might pay a price.
Well, actually, the evidence suggests from around the world that by being in closed spaces where there are lots of people, there are crowds, lots of social contact, there's a high risk of the virus spreading. There's also factors like poor ventilation in these venues. So having this vaccine means you're less likely to catch COVID, you're less likely to fall seriously unwell, less likely to be admitted, less likely to die, and less likely to spread it to others. So you're protecting yourself and protecting others. And you're right in what you're saying. By the end of September, you'll be required to show your NHS COVID pass to show that you have been double jabbed. And as a doctor, my priority is the health. So health comes first for me.
Of course, some young people will say, you know, that's a bit draconian, frankly, and it's a breach of my civil liberties. Why shouldn't I make the choice about whether to have a vaccine? And then, you know, if I want to go to a nightclub, I should be free to do that, whether I've had a vaccine or not.
Well, I'm not a politician or a minister, but what I am is a doctor, and my priority is health. And what I do know is that the evidence supports by having the vaccines, you're less likely to fall seriously unwell, less likely to spread it, and you're protected and you protect others. That's the best way to reduce your risk of problems with coronavirus. So from my perspective, people should be double jabbed to protect themselves and others. In terms of people not being allowed into clubs, that would be for the government to address.
Do you think some young people are perhaps just a little bit complacent, frankly, and don't see the urgency? Maybe they think, yeah, all right, I will have the jab. I'll get around to it at some stage. I probably don't need to do it right now.
Definitely. And I've seen that throughout the whole of the pandemic, really. Young people feel that they are less likely to fall unwell with it. But from my experience working in hospital, and many of my colleagues who are currently working in the intensive care units, they're telling me that they're seeing higher and higher numbers of admissions of younger people in their 20s and 30s who are seriously unwell. And the message for many of those people is, I wish I had my jab.
Now, you've been working hard as a doctor. Have you been able to do much DJing during the pandemic? And when are you going to get back to that?
Well, I've been doing DJ sets on my scrubs, on my Instagram at Vidalia DJ, dancing around to lift spirit, to make people feel good. Last week, I did my first main stage at Camp Festival down at Lulworth Castle, and I'm due to be supporting Fatboy Slim on his UK tour and also supporting Example at his UK headline show next week. But for me, I just want to make sure that if I'm on stage having an amazing time, that everyone in the crowd is safe.
You are a busy guy. Vidalia, thank you very much indeed for being with us. And
Thanks
good
for
luck.
having me.